Our triptych is about daily anticonceptive pills. The birth control pill, also called the pill, is a daily pill that contains hormones to change the way the body works and prevent pregnancy. Hormones are chemical substances that control the functioning of the body's organs.
Most birth pills are combination pills containing a combination of the hormones estrogen and progesterone to prevent ovulation, the release of an egg during the monthly cycle. A woman cannot get pregnant if she doesn't ovulate because there is no egg to be fertilized. Most combination pills come either 21-day pack or 28-day pack. One hormone pill is taken each day at about the same time for 28 days. Depending on your pack, you will either stop taking birth control pills for 7 days, as the 21-day pack, or you will take the pill that contains an hormone for 7 days, the 28-day pack. A woman has her period when she stops taking the pills that contain hormones. Another kind of pill that may change the number of monthly periods is the low-dose progesterone pill, sometimes called the mini pill. The mini pill may be slightly less effective at preventing pregnancy than combination pills. The mini pill is taken every day without a break.
If it's used correctly, it has an efficiency of 99%, and if it's used incorrectly, it has an efficiency of 92%. In case of vomiting or diarrhea, the effectiveness of the pill could decrease. There are several types. It depends on the amount, the type of hormones, and the timing of administration. And it's important not to miss a shot because its effectiveness and is not guaranteed if you forget.
The benefits are everyday use, depending on the type of pill you take for 21, 22, or 28 days, with or without rest for 6 or 7 days cycle. It is important to take the pill every day at the same time. The dose and type of hormone varies between different pills, not interfere with the spontaneity of sex.
My triptych is about the combined oral contraceptive pill, which is a hormonal method that includes a combination of estrogen and progesterone. The common name is the pill, and it has to be taken every day. If not, the effectiveness is reduced, and you have to take the pill as soon as you remember. If women always take the pill, the effectiveness is about 99%. And if the pill isn't taken each day as directed, the effectiveness is reduced to 91%. The advantages are that it regulates periods, so they are less painful. It reduces the risk of uterine cancer. This is because of the progesterone, and it can treat acne. And the disadvantages are that it has an STD protection. This means sexual transmission diseases. It increases blood pressure. It means hypertension, and it slightly increases the risk of breast cancer.
We are going to explain the DIU. It is a contraceptive method, and it in English is called IUD.
There are two types of DIU. The first is the hormonal, that is called the DIU of Mirena. The best advantage is that this type reduces the menstrual blood, and the price is about 165 euros. And the second one is no hormonal, that is called the DIU of Cooper. The disadvantage of this type is that the menstrual blood increases. The price is about 60 euros.
I'm going to explain the functioning of the DIU. It consists in cause a reaction in the uterus of the woman and complicate the action of the sperms. The dispositive of Cooper uses the fact spermicide of this metal to annul the capacity of the sperm, and the hormonal dispositive, the Mirena, release from constant and regular form of progesterone, tightening the cervical mucus. That stops the entrance of the sperma and it can avoid the ovulation.
Here we can see the two types of DIU. The first is the DIU of Cooper, that the reliability of this is 99.7%, and the second is the DIU of Mirena, that the reliability of this is 99.9%.
Here you can see a picture of the position of the DIU in a uterus of a woman.
My triptych is about the daily pill, which is one of the most effective reversive methods of contraception, and it combines the hormones estrogen and progesterone to prevent ovulation, to thicken the mucus around the cervix, and lining of the uterus, preventing accident and possible fertilized egg. And how should you take it? Well, this varies depending on the presentation of the package. If it has 28 pills, those must be taken every day without a break. But if the presentation is 21 units, there is a break of 7 days between packing and packing. If you miss a day, security operation is effective, and it's better to use a method like the condom. And how does it affect the menstrual cycle? The woman who takes the pill will continue with the period, but it will be probably painful and more regular. Who can take it? Women with blood circulation disorders and hepatic disease, diabetes, or if they have or had breast cancer. Is not recommended in women smokers over 25 years, obesity and cholesterol mass, and hormone-dependent cancers or women who had jodians in previous pregnancies. Most of the women who take it have no side effects, or if they do, are very slight, like dizziness, nausea, or headache. It has been shown that the security is 99%, and you can get it in any pharmacy.
Hello, I'm Matt, and I'm going to explain the vasectomy. The vasectomy is a surgical procedure for male sterilization and permanent birth control. In the vasectomy, the vata differential of a man are severed, and then sealed in a manner suited to prevent sperm from entering into the seminal stream. The effectivity of this procedure are for a 99.6%.
I'm going to explain the vaginal ring. Pues eso. The vaginal ring is the hormonal contraceptive method. It has 5 inches of diameter. Its release is female hormones identical to the pill in low, and its effectiveness is 99.7%. Finish.
I'm going to explain tube ligation. How does it work? It consists of cutting or blocking the tubes with the aim to avoid that the ovocet can reach the uterus, that it prevents the fertilization. Has a 94.4% of fiability. How do you do? The Hedger tube requires almost always general anesthesia. The operation produces little discomfort, is carried out in about 15 minutes, and does not require more than 24 hours in a hospital. Advantage is permanent, immediate effect. Disadvantage, rare reversibility, hospital stay. 12 hours rest in house, 2 or 5 days.